Good afternoon, everyone. Thank you for joining us. Welcome back. I'm Steve.
And I am Scott.
And together we are Backyard Musings, the Science and Technology channel.
Yeah, we're talking about a health issue. We like zeroing in on these health issues because it involves everybody. So
Just a little side note, Scott, we did a segment last year. I can't remember when. Remember that box that scientists created where you breathe into it and it takes your breath molecules and it can determine if, something's, you got a disease or something like that. Remember that?
I do remember something like that.
Yeah. So along the same lines, one night of sleep may contain hidden clues that predict major diseases years before they strike. A bad night of sleep usually leads to grogginess the next day, but it may also point to serious health problems years before they appear. Researchers at Stanford Medicine have developed a new artificial intelligence system that can analyze detailed body signals from a single night of sleep and estimate a person's risk of developing more than 100 different diseases. Would you like to know more?
The system, called Sleep FM, was trained using nearly 600,000 hours of sleep recordings from about 65,000 people. These recordings came from polysomnography.
Somnography.
Polysomnography, an in-depth sleep test that uses sensors to track brain activity, heart rhythms, breathing patterns, eye movements, leg motion, and other physiological signals throughout the night.
Yeah, I did a sleep study for the VA, and they put like a little thing on your finger for your heart, your pulse and stuff. Oh, that thing tightly on your finger, I could not sleep because of that. Just because of that.
Oh, you had to wear it overnight.
Yeah, and you can't sleep when that thing's on your finger. It's crazy. Try it sometime. Try putting a rubber band or something on your finger. You won't be able to sleep. Polysomnography is widely considered the most reliable method for studying sleep, typically conducted overnight in specialized laboratories. Beyond diagnosing sleep disorders, researchers realize these tests capture an extraordinary amount of information about how the body functions over several uninterrupted hours.
Quote, "We record an amazing number of signals when we study sleep," said Emmanuel Minot. I hope I'm pronouncing that right. MD, PhD, the Craig Reynolds Professor in Sleep Medicine and co-senior author of the new study, which was published January 6, 2025 in Nature Medicine. Going on with the quote, "It's a kind of general physiology that we studied for 8 hours in a subject who's completely captive." Nice. It's very data rich. Are they talking about the data that's captive, completely captive, not the person?
Yeah, the data. Probably not the person too, because you're probably all tangled up with sensors and stuff on your body. Until now, much of this information has gone unused because it's mindless. Traditional sleep medicine focuses on a limited subset of signals, leaving large portions unexplored. Advances in AI have made it possible to analyze this full data stream for the first time. According to the researchers, this is the first study to apply AI to sleep data at such a large scale.
Okay. Another quote here. "From an AI perspective, sleep is relatively understudied. There's a lot of other AI work that's looking for pathology or cardiology, but relatively little looking at sleep, despite sleep being such an important part of life." That's according to James Zoe, PhD, Associate Professor of Biomedical Data Science and co-senior author of the study. We've got a lot of co-seniors.
Yeah. To unlock the value of this data, the team built a foundation model, a type of AI that can learn general patterns from massive data sets and then be adapted to many different tasks. Large language models like ChatGPT use this same approach, except they are trained on text rather than biological signals.
Okay. Sleep FM was trained on 585,000 hours of polysomnography data collected from patients at multiple sleep clinics. Each recording was divided into 5-second segments, similar to how words are used to train language models. Quote, Sleep FM is essentially learning the language of sleep, Zhao said, or Zhu.
The model analyzes multiple streams of data at once, including brain waves, heart signals, muscle activity, pulse measurements, and breathing airflow, and learns how these signals interact to make this possible. The researchers designed a new training method called leave one out contrastive learning. This approach temporarily removes one type of signal and asks the model to reconstruct it using the remaining data.
Once training was complete, the researchers tested Sleep FM on familiar sleep-related tasks. The model accurately identified sleep stages and assessed sleep apnea severity, matching or exceeding the performance of leading systems currently in use. They then moved on to a more ambitious test, predicting which diseases might develop in the future based on sleep data alone. To do this, they linked sleep recordings with long-term medical histories from the same patients. The researchers had an access to the decades of data from a single clinic, providing a rare opportunity to study long-term outcomes.
Now, this is getting interesting. That sounds cool. The Stanford Sleep Medicine Center was founded in 1970 by the late William Dement, MD, PhD, who is widely regarded as the father of sleep medicine. The largest group used to train Sleep FM included about 35,000 patients between the ages of 2 and 96.
Wow.
Their sleep studies were recorded between 1999 and 2024 and matched with electronic health records that followed some patients for as long as 25 years. The clinic's polysomnography recordings go back even further, but only on paper, said Mignot, who directed the Sleep Center from 2010 to 2019.
That is a wide spread of age there, 2 to
Yeah.
96.
Yeah. That'd be cool if they tracked the 2-year-old up to 27 years old. That'd be cool.
Yeah. Using this combined data set, Sleep FM examined more than 1,000 disease categories and identified 130 conditions that could be predicted with reasonable accuracy from sleep data alone. The longest predictions were seen for cancers, pregnancy complications, circulatory diseases, and mental health disorders, with performance scores exceeding a C index of 0.8.
The C index, or concordance index, measures how well a model can rank individuals by risk. It reflects how often the model correctly predicts which of two people will experience a health event first. Quote, for all possible pairs of individuals, the model gives a ranking of who's more likely to experience an event, a heart attack, for instance, earlier. A C index of 0.8 means that 80% of the time the model's prediction is concordant with what actually happened.
Wow. Yeah, that's pretty amazing.
Yeah.
Sleep FM showed especially strong results for Parkinson's disease, dementia, hypertensive heart disease, heart attack, prostate cancer, breast cancer, and death. Wow, that's
all the things that Scott said. They are above 0.8. They range from 0.81 to 0.89.
Yeah, and that's pretty good numbers, right? That's pretty impressive.
Yeah, for diagnosing, predicting.
Quote, we were pleasantly surprised that for a pretty diverse set of conditions, the model is also to make informative predictions, Zhou said.
Zhao said that models with lower accuracy, often around a C index of 0.7, are already used in clinical care, such as systems that predict how patients might respond to certain cancer treatments. The research team is now focused on improving Sleep FM's accuracy and understanding how it reaches its conclusions. So they don't understand how it reaches its conclusions. That's pretty funny. Future versions may incorporate data from wearable devices to capture even more information about daily life and sleep habits.
While heart-related signals played a larger role in predicting cardiovascular disease, and brain signals were more influential for mental health conditions, the researchers found that no single signal was enough on its own. The most accurate predictions came from combining all data sources.
And that makes sense. The whole all above the line approach.
Yep. And we just need to broaden our study, it sounds like.
Yep.
So, yeah. This is cool.
Yeah. All right, folks. Thanks for joining us. We'll catch you in the morning.
Take care, everyone. Have a good afternoon.